This week we're talking about the ankle derangement, what that is and how to treat it. But first, our disclaimer. Mike Matthews, physical therapist here with the PT 411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So like I said, today we are talking about the ankle derangement, also known as an obstruction or impingement, tomato, tomato. But the big thing there is we have a problem with the ankle. It's a little bit harder to diagnose at times. It's not quite an ankle sprain. It's not quite other traditional injuries that we see happening in the ankle, but it can definitely cause a lot of problems with us. There are many causes, many thoughts to why this occurs, why this happens. The two leading theories, the two leading issues that happens with this is after an ankle sprain, things get thrown out of whack. An ankle sprain is whenever we roll our ankle and it ends up damaging our ligament there. It presses our joint as far as it can in one direction or the other, to the point that the ligaments that are supposed to hold things into place get overstretched and it takes it a little too far. And what ends up happening is not only is that causing an injury there, what can also happen is that joint is getting fully closed down in one area, fully opened up in the other area. Things can get pushed from the closed off area to the opened up part of the joint, and that can actually cause lots of issues. Those things can get dislodged far enough that they're actually obstructing movement and throwing off the natural kinematics, the natural alignment of that joint. Now, one of the other big causes is just repetitive movement. We get into a groove, we get into a common way of how we're carrying our bodies. It can happen anywhere in the body. Down in the ankle, what can end up happening is we're always collapsing that joint. We're always collapsing that foot inward. So it's always getting closed down a little bit in one spot, but always opened up in the opposite direction each and every time we take a step. Same thing happens, but it's slower progressing. Things get pushed from the closed off section into the opened up section. Things get dislodged and it obstructs our movement and alters the resting position, or the movement position for that matter, of that joint. One of the major signs that's often missed with diagnosing this is how our pain is behaving, what actually happens when it is actually bothering us. Now, if it only bothers us whenever we are moving and whenever we are putting stress through that ankle, it's probably something else. It's probably not this derangement. It's probably not getting obstructed. Because the thing is, if it's only bothering us as we're loading it, it's got to be something like the tendon or a muscle related to the tendon, or it could even be the ligament that's getting involved. Sometimes the derangement can occur whenever we're putting weight through it, whenever we are messing with it, but oftentimes it's also going to hurt at rest. Now, the things that will not hurt at rest are the things I just talked about: the tendon, the ligament, the muscle, and a few other structures in there. Those will only hurt whenever you have pressure putting through it. But with the derangement, big thing that'll happen is you'll have pain at rest long after the inflammation phase. Now, the first few days after an injury, yes, you're going to have pain. Inflammation itself can cause pain, can cause problems in there. But once you get past that initial injury, we get weeks, months down the line, everything related to the sprain or to the tendon or muscle tear ends up healing. We get way down the line, we're still having problems and we're still having pain at rest. More than likely, we have a derangement that we need to get fixed. We need to get that thing, whatever it is that's obstructing our motion, we need to actually mobilize it, get it right back where it needs to be. Now, it makes it very easy to treat. If we had a recent ankle sprain, we know exactly what caused it, and typically we just have to go in the opposite direction from the injury to get things moved back where they need to be. Now, the most common way for us to injure that ankle there is from an inversion injury. Sometimes, yeah, we do see eversion injuries, but most of the time it's some sort of inversion injury, and usually it's not just simply going straight in. Usually it flexes down as it goes in, as we roll that ankle. So if it's been a long time since we sprained that ankle going inward, we're still having pain, we're still having problems, it's time to try to treat this here. So as I've been talking, you've noticed I've put myself into this figure 4, this cross-legged position here. This allows me to fully access this right here, and it keeps my gastroc, my big head, my 2 big heads of my calf muscle here nice and on slack. That way they don't get in the way of me trying to mobilize these joints right here. So we're crossed over right here. The first big thing that we need to do is start working it into that eversion away from that inverted sprain right there. So we're gonna grab onto our foot here, and we're actually gonna grab on from underneath, and we're just pulling it into that eversion right there. We're just doing a repeated movement there, nothing too crazy. If it's real painful, we back off, we flirt with that discomfort over time, see how it reacts to it, see if it lets us go further and further into that movement. And if you start to see it going further and further, that's a good sign. Or if we're producing pain and that pain is very diffuse and all over the place, but as we repeatedly work on this, that pain moves to a smaller area. Even if that pain's getting more intense, if we can get that pain area to move down to a smaller pinpoint spot somewhere on this ankle, that's always a good sign. So we just repeatedly move it in this direction, do it about 15 times at a time, seeing if we can get it further and further there. So if we start to see these signs, it's a good sign that we're going in this direction, so we can actually start to add on to it. Not only are we going to evert it right here, we're going to evert it and dorsiflex upwards. So now not only am I everting it out this way, I'm getting that dorsiflexion here to fully wind it up in that opposite direction from that inversion and plantar flexion injury that we previously had. So we're just going to repeatedly move it. So we're scooping from here, everting and pulling up into dorsiflexion. Same thing, working that set of about 15 at a time, just flirting with that discomfort. See if it slowly lets up to let us go further and further here. Now to progress this further along, we can get weight bearing here. So in order to do that, start off with our foot on an elevated surface. We're just gonna lunge into that, keep our heel down, just lunge forward into that dorsiflexion first. So we're gonna go backwards on this one. We're not gonna do eversion first, we're gonna go into dorsiflexion first here. So now to progress this further, we can grab something to prop up the outside of our foot. From here, we're gonna do the same thing. Going into that forced dorsiflexion, actually putting weight through it as we mobilize there. Same thing, about 15 times each set we do this. And what I forgot to mention about these derangements, we can't just do our 2 to 3 times a day. This needs to be done about every 2 to 3 hours to make sure that we're not only mobilizing it, but also to make sure that what we are mobilizing is staying put and it's not just going back into that obstructed position. So we need to do this one frequently enough to prevent that from happening. So now on the other side of things, if we ended up having a sprain going in the opposite direction, where instead of having that inversion sprain, we had more of an eversion sprain, we need to go in the opposite direction, because pretty often this is also associated with more of a dorsiflexion than that plantar flexion whenever it everts out that way. So we just have to start off going in the opposite direction here. We're actually going to push our foot going downward this way. So instead of using this hand that scoops around the top, we can actually grab with this other hand here, and we're pointing downward, looking for those same signs. Either symptoms are getting better and it allows us to go further, or that pain starts to localize to a smaller point, even if it's getting more severe. And working past that, adding in actually that inversion this time, so plantar flexing and scooping in to that inversion there, looking for those same signs. Now progressing this is going to be pretty similar. We're putting weight through it this time, but now we're putting our foot straight down. So we're going to press our foot straight down first, using our leg, going into that plantar flexion, flirt with those symptoms again, look for those signs to progress it further. And really, you don't need anything extra to prop it up with. Whenever you want to start going into that inversion there, you just rock your foot towards the outside a little bit in order to get that inversion. So let's say that we didn't have an ankle injury, we didn't sprain or roll that ankle, but we're still suspecting that we might have this ankle derangement here. Go through this same progression. Start off with the dorsiflexion and the eversion, and if that's not helping, if you feel like that's actually worsening things, try going in the opposite direction into that plantar flexion with that inversion. Work slowly into each of these, give them a chance to work. Don't judge it too quickly, but if you just feel in your gut that as you've been working on this, that it's getting worse and worse, go ahead and switch it, go with the other direction here. I would personally start off with that dorsiflexion and eversion, the first one that we went over here, because I see that a little bit more commonly in the clinic with people that don't have ankle sprains, but we think has this derangement going on. But if you feel like that you want to try out the other direction because you're always putting that foot in that opposite direction, which is definitely a telltale sign when I go through history with people, you can start off, if you feel more comfortable, going that other way. Now, I still have a few more videos planned out over the next few weeks regarding the ankle, so make sure you stay tuned for those. Again, I'm Dr. Mike Matthews with the PT 411. Thanks for joining me.